Are you experiencing stress due to remote learning during COVID-19? If so, you're not alone. We're going to talk about ways to manage the stress as remote learning continues during this new normal. This is a stressful time for all of us, and it is normal and appropriate for parents and for children to be experiencing the stress of COVID-19. Something that's been especially stressful is that it's put so many parents in the situation of having to juggle working from home with managing their children's remote learning. One thing that I recommend is looking for ways to establish boundaries. You could do that through establishing some semblance of a routine. It doesn't have to be a strict schedule, but just making sure that you have regular meal times and times of day when you're definitely working and times of day when you are definitely not working. So one thing I definitely recommend is that parents try to set aside time for quality time with their kids. We're around each other more now, but the quality of that time has gone down for many of us. Try to set aside time for quality times, that you're not always trying to work while they're trying to go to school in the background, but that there are also dedicated times that you spend to just enjoy each other's company. When you see your child feeling stressed, one thing that I definitely recommend is being an active listener. So rather than waiting for your child to reach out to you, reaching out to them and letting them know that this is stressful and you're here for them. If your child doesn't want to talk about it, that's okay. Go ahead and give them their space. But at least that way they know that you're there and that their stress is normal. It's not something strange or wrong about them. When your child does come to you with concerns, the first thing that I recommend is to just listen to them. As parents, it's really normal to have an urge to comfort our children and reassure them that things are okay. But in this situation especially, that could inadvertently have the effect of invalidating their feelings. After you've listened to their concerns, see if there's something that they can do today that might make them feel a little better. We can't make the pandemic go away, but maybe there's some small thing that they can control in their life right now that might bring them some sense of relief. While a certain amount of stress is normal and even appropriate, there are some symptoms that may be a sign that you could benefit from further treatment. Among adults and children, these can include difficulties with sleep, changes in appetite that cause an impact on weight, either weight gain or weight loss, loss of interest in activities you or your child used to enjoy, difficulty focusing or paying attention, more frequent bouts of tearfulness, or even increased irritability. You may also experience excessive worry and difficulty relaxing, or a lack of energy and persistent feelings of fatigue. While children may also demonstrate all of those symptoms, they may also have unique symptoms of anxiety and depression. These can include fluctuations in grades. So for example, if you notice your child struggling with a subject that used to be easy for them, many children will manifest symptoms of anxiety and depression physically. So your child may complain of stomach troubles and not really be able to identify the cause. If your child is having difficulty focusing or avoiding activities that they used to like, that could be due to anxiety or depression related to the COVID-19 pandemic. If you or your child are experiencing any of these symptoms, or if you would simply benefit from talking to someone, many providers are offering telehealth visits that you can attend from the safety of your own home. While this time is challenging, it's important to remember that remote learning helps slow the spread of COVID-19 and keep children and family members safe. This will not last forever. By following these steps while remembering to wash your hands regularly, wear a mask when in public, and practice social distancing, we will get through this pandemic.